Hello everybody and welcome to the Tuesday edition of Video Clips. And the first thing, just a couple of announcements. We always do Valentine's Day specials in February. And so if you want a special certification package, you can even get some certification courses for free. Anyway, I'm not going to try to explain it to you here because you guys get a little antsy if I don't get to the material right away, but call the office and talk to us about it, 614-841-7700, or send an email to pampopper@msn.com. And as usual, and you guys are contacting me more about this, if you're interested in a career doing something like what you see I'm doing, whether you're a health professional or not, let me know. I can send you some information. We can schedule a call. There is lots of opportunity in this field because people are so hungry for knowledge. So speaking of knowledge, I'm going to start today with an example of informed medical decision making and what that looks like in a real live person. So I get emails like this all the time. And so this email I got earlier this week, and a person writes, I'm scheduled for a lumpectomy. I have a 2-centimeter lump in my breast. The doctors recommended either balloon internal radiation or external beam radiation, depending on whether or not there's cancer in the lymph nodes, and an aromatase inhibitor for 5 years. What should I do? Well, the first thing is I never send back what you should do. It would be irresponsible not knowing anything about a person's health and that sort of thing. But where we might start is looking at the lymph node analysis as a justification for which type of radiation. Lymph node dissection is considered the gold standard. It's evidence that the cancer may have spread if you find cancer cells in the lymph nodes. The assumption also is that the more nodes that are affected, the more aggressive the cancer would be, and the worse the prognosis would be. However, 25% of women with no node involvement develop distant metastases, and a 2002 analysis concluded that lymph node analysis is not effective for determining metastases in women with invasive breast cancer even. So the first problem here in this individual who wrote to me is that the patient's doctor is going to make a decision about what type of radiation based on criteria that have been deemed ineffective for determining outcomes. So the first thing that an informed consumer does is to say, this doctor has already given me some information that may not be very good, so now I'm going to be particularly diligent in looking at what comes next and other recommendations made by this doctor. And by the way, we're not trying to play gotcha with doctors here. We're trying to empower people to deal with their doctors in a way that allows them to have better outcomes. So what would happen next? Well, you would ask the doctor for research studies on radiation. What are the outcomes? What are we looking for? Does radiation reduce the risk of recurrence and extend life? And if so, to what degree? In other words, a meaningful risk reduction to somebody might not be a 2% reduction in the risk of a recurrence, or no evidence that life is longer as a result of doing it. And then the same thing with the aromatase inhibitors. So, and of course, it is very specific to the person, because I've said this many times, I don't think there's a lot that we do in medicine that doesn't have some applicability. The problem is the overuse of these types of things that we have to be very, very careful about. So anyway, if the doctor refuses to provide, that kind of speaks volumes, but we can always find these things in our database. We have a lot of information about this type of thing, and we can do searches and show people how to do searches and evaluate this type of information. So that's what an informed discussion is like when somebody is considering how to address a diagnosis, whatever it is, ranging from chronic infections to cancer. And if you don't know how to do this on your own, that's why we're here. That's why our databases are here. This is the type of thing that we provide. One other thing I'll mention is Research and Writing starts tonight. And this is more education on how to look at information and make good decisions for you and your family and other people who you care about, or in the health professions to think a little bit more in terms of patient outcomes when you're evaluating information, and how to find stuff that's really hard to find but that can really make a difference in your practice. We record these classes, by the way, so by the time you watch this, the class has already taken place. You could still jump in and participate. So anyway, a lot of people ask me, what does this really mean, this informed decision-making thing? So I thought I would start today by giving you a little bit of an example. And we do this with all kinds of conditions. Like I said, it doesn't matter if you're thinking of taking a supplement, adopting a diet, whatever it is that you're thinking about doing, I think you should look at information before you make a decision. All right, we're going to talk about cancer again here. There are many things that people can do to reduce their risk of cancer, and you know a lot of them: adopting an optimal diet, losing weight, not smoking, drinking alcohol only on very special occasions. Those are known strategies for reducing the risk. But here's another often, maybe always overlooked strategy for reducing the risk of cancer: don't develop any other diseases. According to a new study that included over 405,000 patients, having markers for cardiovascular disease like high blood pressure and high cholesterol, markers for kidney disease, pulmonary disease, and gouty arthritis, and conditions like diabetes increased the risk of both developing cancer and dying of it. The effect was dose dependent. The more abnormal the markers and the more serious the disease, the higher the risk, with the highest levels associated with an over twofold risk of cancer and an over fourfold increased risk of dying of cancer. Together, these markers and conditions contributed to over 20% of all cancers and 38.9% of all cancer deaths. Now, to put this in perspective, this is comparable to the risk associated with all 5 major lifestyle risk factors combined, which include smoking or a history of smoking, not enough physical activity, failure to eat enough fruits and vegetables, alcohol consumption, and obesity. Total cholesterol and proteinuria, which is a marker for kidney disease, were the strongest predictors of cancer risk. The researchers note that chronic disease is not commonly identified as a risk factor for cancer, and resolving chronic disease is not listed as a target for prevention. They say that failure to do this is a missed opportunity and concluded, quote, recognizing the substantial reduction in lifespan and increase in cancer risk associated with non-cancer chronic diseases could be used as a teachable moment to stimulate motivation for better management of such diseases. I could not agree more. Over the years, I have met so many people with cancer who are really surprised by their diagnoses. They often will consider themselves healthy and feel that they're doing better than others they know. Their opinions about their health status seem completely disconnected from their medical history and from reality. They're overweight, they have significant medical history, they take or have taken several medications. I think that one of the reasons why people don't really stop to think this isn't right and it might have contributed to my developing cancer is so many people are overweight and sick right now that perhaps it's just become the new norm. These data show clearly the importance, in my opinion, of resolving chronic conditions whenever possible. The current way that we treat conditions like cardiovascular disease and type 2 diabetes addresses symptoms and biomarkers, not the underlying disease, which continues to progress. And these diseases, the things that we're talking about, diabetes, coronary artery disease, autoimmune diseases, they all decrease quality of life and they can impact longevity quite a bit. But if people live long enough, they can end up with much more serious conditions, including cancer. So the good news is that the diet and lifestyle habits that would resolve the biomarkers and conditions listed as risk factors also are proven to be highly effective in preventing cancer. So I think I continue to be amazed at the breadth of diet and lifestyle effects. It isn't just one thing. They affect everything when you're willing to make the right changes. So one of the things you might do with this information is examine your own self and say, if I'm carrying extra weight, if I have anything that's wrong with me, and I'm not talking about minor things like hangnails, because people will get a little obsessive about this sometimes, but I'm talking about if your blood pressure is high, if you have sinus infections frequently, if you have GI disorders, don't just think of these as, gosh, if this happens to everybody, but more, get to the bottom of it and get rid of that particular condition as a risk factor for cancer. And I agree with the authors, that might motivate people most of all, because I think cancer is the most feared diagnosis in the world. All right, now while we're talking about diet lifestyle habits, it's true that eating an optimal diet and exercising are necessary in order to achieve optimal health, but there are other factors that deserve more attention. For example, having a rich social life has a greater impact on health than quitting smoking. Think about that for a minute. Membership in clubs and political organizations, religious observation, close ties with family and friends, and going places and doing things aren't just fun, but essential for achieving health. And I was really amazed at how much research I was able to find on this issue. One analysis of 148 studies showed that the benefit of social integration was as important as other well-known strategies for reducing risk of mortality, and risk was reduced by as much as 50% for people who had really strong social relationships. Close friendships can reduce the risk of chronic disease and result in higher levels of happiness, in addition to reducing mortality. Now, those of you who have close friends and enjoy them know that you might even be smiling as you're talking about your friends, or smiling in response to this video clip because you're thinking fondly of your friends. People who cultivate friendships instead of relying primarily on family for social activities benefit even more. A study of 6,500 people in the UK showed that people who have 10 or more friends at age 45 have significantly better psychological well-being than people who have fewer friends. And so what we see is when it comes to both physical and mental health, friends have a dose-dependent effect. The more friends you have, the more positive the effect. The older we get, the more important these friendships become. The quality of relationships is also important. So I've been talking about how friendships can protect health, but there's also some good evidence that if you have friendships that are strained, the opposite effect can happen, and that this can increase your risk of adverse health effects. So your mother's advice about the importance of the company you keep was right. And I know in my own case, I've dealt with this on a few occasions where I've looked at people who I spend time with, and I want to make sure that those relationships are ones that quote-unquote feed my soul. And I have a few people who I only like to deal with when they're in large groups. It seems like the effect of the group sort of blunts the negativity of their effect, and it's okay to do that. It's called self-preservation and taking care of self. Now, if you're married or have a significant other, having strong social connections benefits not only you, but your spouse. In a study of older people, those who socialized with friends more frequently had fewer depressive symptoms, and the same was true for their significant others. So the more you have a strong social network and the happier it makes you, the more likely the carryover effect to your spouse. In fact, several studies have shown that relationships between spouses and significant others are better if both individuals who are part of the partnership have these types of social connections. These studies are really consistent with Dan Buettner's accounts of people living in the blue zones. He's the author of the book on the blue zones. One of the strategies, and there's a list of, you can read these online, there's a list of blue zone strategies that are supposedly responsible for their good health, and one of them is, that's associated with longevity, with social relationships with friends in addition to family members. So here's the bottom line. Good health is the result of doing a lot of things right. Eating and exercise are just two of them. Friends and social activities are part of the rest of the list. So make plans to do something with your friends this week or weekend, and we'll just call that doctor's orders. All right, that's all for today, as usual. Pass this on to anybody who you think might enjoy watching it, and I'll be back to you on Thursday with more news.